The plantar fascia is a ligament that goes from the ball of the foot and attaches into the heel. It basically serves as shock absorption for people when they walk. Some people develop pain and inflammation in that area if they get repetitive stress to that area over time. Sometimes the pain with plantar fasciitis can be a sharp pain, a dull pain. Some people report pain after prolonged periods of rest. A lot of people will report having pain when they first get up in the morning and take their first few steps, and they'll feel a sharp, intense pain in the bottom of their foot. That's a big sign of plantar fasciitis. Other people have pain after prolonged activities like runners or people that walk on their feet all day at work. If you started noticing pain after you do those activities, you may have plantar fasciitis, especially if it's at the bottom of your heel. The typical demographic are people between 40 and 70 that are still fairly active, but it's not limited to that age group. Some people get it based on the type of foot that they have. Some individuals have a higher arch foot. Some individuals have a lower arch foot. This can cause stress on the plantar fascia ligament and result in getting plantar fasciitis at some point. The heel spur does not cause plantar fasciitis. Some people will be diagnosed with plantar fasciitis, have x-rays, and report they have a spur, but the spur doesn't cause the symptoms of plantar fasciitis. Some people have spurs and have plantar fasciitis. Some people don't have spurs and still have the same symptoms. What the heel spur represents is an area of stress on the bone. Bone is living tissue, and when you apply stress to bone, it grows in the direction of that force. So all the spur is just an area of prolonged stress on the bone from the ligament, the plantar fascia. The first thing we want to do is we want to get rid of the inflammation. And I do that by performing an injection with a corticosteroid to the area of pain, usually in the plantar aspect of the heel, or the bottom of the heel. After I give the steroid injection, we can also put a patient on a regimen of anti-inflammatories if needed. The next thing I want to do is start doing stretching to the area. So we provide stretching exercises to patients in a pamphlet. We also can do physical therapy, which will give patients several modalities in terms of stretching, strengthening, to try to alleviate stress off of the ligament. I also provide patients with something called a night splint. And as I mentioned earlier, a lot of people have pain right when they first get up in the morning or after prolonged periods of rest. What the night splint does is it stretches that ligament out during those periods of rest. And when patients get up in the morning, they don't have that same pain. Lastly, after we've dealt with the inflammation and after we've addressed the stretching that's necessary and rehab that's necessary, the last thing we want to do is prevent it from coming back. And the way we do that is by getting some custom orthotics or arch supports to go up underneath your foot, and this supports the ligament and it reduces the stress on the ligament over time so that you don't keep getting the same problem over and over and over again. Everyone's different, but typically the first 3 to 5 days in my experience, most people start noticing improvement. Sometimes after the initial steroid injection, there can be a little bit of pain over the next 72 hours, but that typically resolves and you should start noticing an improvement after that. If you're having any of these symptoms, any pain in your heel when you ambulate, just give us a call. We'll go ahead and take care of it and get you back on your feet quickly and efficiently.